even if you're in the dark part of your recovery right now, things are feeling really challenging and you're having a hard time, can you just stop and appreciate how your body went through this big thing and now you're on the other side of it?
Hey, it's Brad, and boy, am I happy you're here. If this is your first time, I'm really glad you found us. You're not going to be disappointed. And if you've been here before, welcome back. This is Pain to Performance. Let's jump into today's conversation. All right, everyone. Welcome back to Pain to Performance. I am so excited today. I have Dr. Laura Glazebrook with me today. She's a doctor of physical therapy who specializes in scoliosis, spinal fusion rehabilitation, pelvic health, and pregnancy and postpartum care. Laura's work is deeply personal. She was diagnosed with scoliosis at a very young age and underwent spinal fusion herself, which gives her a lived understanding of what it feels like to move through the world in a body that has been labeled fragile or limited. What I appreciate most about Laura is her philosophy. She does not lead with fear. She leads with education, adaptability, and ultimately confidence. Her work helps people connect with their bodies and not avoid them. Today's conversation is going to be far from beyond posture or pain relief. It's going to be about resilience and adaptability and what makes things possible when we stop fighting our bodies and start working with them. This conversation is for anyone who has ever been told that their bodies are fragile and not capable. Dr. Laura, I'm really glad you're here. Welcome to Pain to Performance.
Thank you, Bradley. So happy to be here with you today.
I am just over the moon. I cannot begin to explain how excited I am to have found you and to have really been able to get on your radar. Like, you are a busy woman.
I am.
So let's kind of dive in here. I ultimately really want to talk more about you, right? I want to start with you, not necessarily your credentials. So tell me a little bit about what makes Dr. Laura Dr. Laura.
Well, I will try to keep it brief. I could probably go on for a while, but
you can make it as long as you need to.
My story as far as what I have become really does start when I had my spinal fusion surgery. So I was just a kid, relatively young when I went through all of that. Most kids with scoliosis, they don't actually go under for spinal fusion surgery until closer to like teenage years. So,
Wow.
14, 15. But unfortunately, I was diagnosed with scoliosis. I was very young. I was, I think, 10 when it was diagnosed. Although now with the training I have, looking back, I saw it as early as 7. I saw signs of the scoliosis. Wow. But regardless, the doctor did not actually diagnose me and send me to an orthopedist until I was 11. And within 6 months, they determined that I would need the spinal fusion surgery because the scoliosis had progressed too much. So it was December 4th. I'll never forget that date. When I was 11 years old, I went into Scottish Rite, which is a local kids hospital. And I underwent a very scary and painful surgery. And basically I woke up in a brand new body. It hurt to move. It hurt to get out of bed. Wow. It was hard to walk. So that was basically, and I didn't really get any guidance. I woke up after the first couple of days of, initial recovery. You have a physical therapist that comes in and helps you get up and walk and do stairs. And that was when the seed was planted of physical therapy being an option as a career. Because I thought this is actually kind of cool. You can kind of teach someone how to move. But other than that, I really didn't get any other guidance on what was next or how to be in the world with this brand new body and this brand new spine. And really, my parents didn't know how to support me. So I kind of just had to figure it out on my own from there.
Wow. So it does. So ultimately, my goal today is to be able to uncover that, right? And I really think that this conversation is going to shift how people think about their bodies entirely, because I think you've had to do that yourself. And so I'm really curious. How did your own surgeries and things that you've gone through in your life shape the way that you talk to patients now?
Well, I think the big, my, and regardless of what I do, working with patients in person, working with virtual clients, talking to people on the internet, my big thing is empowerment and
Mm,
the way speaking to ourselves gently, and just trying to reframe how we think about our bodies, not necessarily by what they are not or what they cannot do, but
mm-hmm,
more
mm-hmm,
from the perspective of, okay, maybe these are some limitations, but
mm-hmm.
I can do all these things, and my body is amazing because X, Y, and Z, whatever that is.
Mm. I love that. So earlier you said that you didn't really have anybody to kind of help you through this process. And you said that's really where a lot of your inspiration came from. And I'm really, really interested to see how what no one explained to you then early on in whatever your recovery might have been, which sounds quite large.
It
Do
was
you
intense.
now do you now explain those types of things every single day? I think what I'm trying to understand is, what kind of practitioner are you? Are you that individual that like really sits down and gets their elbows dirty and really figures out what's happening? Or are you like one of those individuals that will kind of stand back and let things unfold to you?
That is an excellently worded question. And I will say I try to be a little bit of both. And I think what the approach that I take depends on the person that's in front of me. So I
Hmm.
see a
I
wide
love that.
variety of people, in person and online. I see kids. So I see, kids and their family. I will see adults. I will see people who are healthy. I will see people who have chronic pain. And so I think I try to use a little bit of, emotional intelligence to try to figure out what is it that
Sure.
this person is needing, because some
Uh-huh.
people, they have the capacity to do the getting the elbows dirty, and I feel like it's important to educate people to know what it is that they're facing or what's coming up, and especially if they're preparing for something like a surgery, I do want them to
Mm-hmm.
know what's going to happen, and just give them the basics, the things that maybe the doctors or their team didn't tell them.
Mm.
But at the same time, I also have people in front of me that have a story similar to mine that maybe didn't get the space to process what has happened,
Mm.
whether
Ah.
whether they considered it really traumatic or not. I think sometimes people, they need that space.
Yeah. And I actually just recently talked to a psychotherapist, and the what we discovered in that conversation was that it doesn't matter if you recognize it or not. The body always does. The body recognizes the trauma. It's going to carry it forward. And I'm realizing through this entire situation, I never really quite asked you, what was the surgery that you ended up having, and how life altering and changing was that for you?
Sure. So when someone has a severe scoliosis, what they're usually trying to do is they do a spinal fusion. And for people with scoliosis, that's usually called a long spinal fusion. So
Okay.
for most people, they will choose a number of levels in the spine to basically stabilize. The procedure they use now is actually a lot better than what they had when I was a kid, almost
Oh.
30 years ago. But essentially, they used at the time Harrington rods, so just like
Mm.
two titanium rods, and they tried to fix a lot of the vertebrae to those rods to stabilize
Mm.
the curve.
Mm-hmm. Mm-hmm.
So what that means, and like I said, the technology of how they do that is better now, and what the results are better. But essentially, what it means is I have an entire portion of my spine that no longer moves. So I can't really twist from my mid back
Wow.
like most people can. I can't bend like, I have this joke with some of my friends with spinal fusion. Like if we were in an airplane crash, like I couldn't do the brace position because I don't bend in half.
Okay.
So luckily for me, I don't actually experience much pain. I
Okay.
think people will look at how the appearance of my back and make assumptions that I do experience pain. For me, it's not so much pain, although I do deal with some body image issues because of how my body looks. Um,
Okay.
but
Okay.
it's a big surgery, and a lot of especially teenagers that go through it. It's a very invasive surgery, and it takes
Absolutely.
a long time to recover.
What's the average recovery time, speaking from like a physical therapist perspective?
I think it depends on how invasive the surgery is. The kids that I'm
Okay.
seeing these days that undergo it, normally they're out of school between 4 and 6 weeks, and then
Wow.
they are returned to school. And it very much depends on if it's a smaller fusion or, but for most people, if we think about healing timelines, which I know, like as a massage therapist, you probably have some understanding of that, but knowing that it takes between 6 to 8 weeks for the bones to fully heal after that,
Hmm.
plus the skin, plus, the muscles, and they're usually having quite a bit of pain afterward. So it's quite a recovery process.
Yeah, that connective tissue is always the worst to heal too. And as a physical therapist, that's really what it is that you're working with, right? Is a lot of connective tissues. So let's just take a step back for a minute. So with the knowledge that you have now and the experience that you've gone through prior to, if you could have been in charge of your own recovery plan, whatever it may be, how different would it have been compared to what it is that you went through?
Brad, you're not supposed to try to make me cry, but here we are.
I'm so sorry.
It's okay. Well, I've thought a good bit about this, and I think that I'm sure anyone who's been through a major event, whether you classify it as trauma or not, I'm sure we all have a certain amount of, thoughts and feelings. It takes a certain amount of brain space. I
Sure.
think the thing that I wish for is when I had my surgery, and in some ways this hasn't really changed for kids who are going through this now.
Okay.
They're when they give you the, giant packet of information that you get before surgery, it talks through the day of the surgery, the day after the surgery, but then that's pretty much it. So there's this pre-op where they talk you through all
Wow.
of, yeah, they talk you through all of the, this is come to the hospital this time, make sure you don't eat. Like these are the things that will be the
Uh-huh.
like immediate 72 hours after. But so for me, I was the youngest in my family. I had an older sister, but just my parents and her. And honestly, none of us, they didn't know how to support me. I didn't know what I was 11, so I didn't really know what I needed. So I had this major surgery. I finally get home, and then you do a couple of follow-ups with the orthopedist, and they're like, "All right, bye." And I'm like,
Like it
"Wait,
looks
so
good.
yeah," they're like, "Okay, your surgery's healed." And I'm like,
Mm-hmm.
"So what
But
do I do now?"
wait, there's
There was
way
no
more.
guidance. Yeah, there was no guidance on how to learn how to be in
Wow.
my body. I wish I would have had
Is
access
that
to
the
like a physical therapist.
is that the same now?
Kind of, yeah.
Wow. Eh,
Yes.
wow. That's honestly heartbreaking. And so, Laura, I can see why you're so passionate about this. And I can absolutely see why you've gone into what it is that you're doing now. So I kind of want to transition now. I don't want to make you cry, Laura. That's not my goal today. But I kind of want to transition a little bit more into the idea of when people hear your credentials, they probably assume that like what you do for work, and it's probably about posture, pain relief, and recovery. How do you actually describe what you do?
I try to describe myself more of like a movement coach and more
Okay.
of a kind of, I think coach is the word I try to use. teaching someone how to kind of be in their body more, a guide to
Mm,
how to re-embody yourself and to figure out in whatever your issue is, whether it's a spinal issue, whether it's something else, whether it's just chronic pain, to try to find a way to be comfortable in your body.
mm,
And that can look any number of ways. That might include some manual therapy. That usually includes some kind of exercise that,
mm. Sure.
sometimes there's some inner work we sort of have to do, or just, find some way to just be in your body more.
I got that. So you people assume that you deal with pain relief and the recovery. Why is it that you think people tend to stop there with the conversation?
I mean, I think that partially it's because of the way that our medical model is set up. I
Mm,
think
okay.
that there are many things that, not that there are any perfect systems out there, but I think that because of the way that the American system, which is where we're both working in,
Yeah.
it's so very focused on pain and disability. And, you see someone until the pain goes away. And then, like, it's always very focused on pain and dysfunction.
Hmm.
And I think that's where it
And
comes from.
I firmly agree with that, and I want to divulge on that just for a brief second. I don't know about you, but the patients that I see, I really like to deal with the edge cases. I like the people that are like, I have been to every single thing that I know to, and nothing has helped. And I talked about this recently, how I firmly believe sometimes people are so stuck in their own mind that I'm never going to get better, that it's hard for them to be able to change that mindset. And as somebody that works with that day in and day out, is a doctorate of physical therapy here, how how do you help your patients really try to get over that mental hump? Because honestly, recovery is just as much mental as it is physical. And that's where we talk about that the body isn't fragile. It's not broken. It's just a new reality. How do you help them understand that new reality?
That's absolutely correct. And that is one of the tenets of everything that I do. I feel like I try to just decenter the pain experience. Not that I'm discounting it, not that I am
Sure,
minimizing it,
of
but
course.
I decenter the pain experience and I try to start focusing on something different. At
Mm,
some point, I think it was maybe in a book that I read, but if you cannot, and if someone is dealing with a chronic pain and it's a pain that is, for some reason, regardless of our best efforts, if that pain is not going away, or if
mm,
it's taking longer than expected, we have to make life bigger than the pain. So I
mm,
think sometimes people that have experienced severe pain or acute, or chronic pain,
mm,
they get limited because their brain is in this protective response. And I think sometimes
mm.
we require a little bit of gentle coaching to find the safety in our brains to say, okay, well, maybe I'm having this pain, or I have had this pain, and just understanding that they can still have a really wonderful, experience in their life
Sure.
with these, whatever it is, or just even accepting that I'm having pain right now. It doesn't mean I'll have pain forever. It doesn't mean that I
Yes.
will not be able to work out of it.
I love that. And that's something that's a core tenet for me as well, Dr. Laura. I absolutely don't ever want somebody to ever think, feel, or potentially possibly have an understanding that their pain is just something that will stay with them forever, right? Sometimes we have to have the acceptance that it is a possibility that it's going to happen, right? But a it's a matter of how it is that we can actually move past it and get better with it. And a lot of it's a lot of understanding. And I think that kind of brings in this idea that the body is a connected organism, right? We are consistently connected. Our the mind body connection, there we go, is definitely alive and well in a lot of us. So you've talked about our body being a connected organism, right? Previously, what does that really mean in practice for you specifically?
Yeah, so I've had several experiences just within myself, within my own body. I also have two kids who have had, various issues. And I think sometimes we can very much compartmentalize things within our body. So, I mean, thinking
Mm,
again about just our medical model, we have a
yeah,
dentist who looks at our teeth. We have an eye doctor
sure.
that looks at our eyes. Even
Uh
here
huh.
in the Atlanta area, you have like orthopedists who will focus on a single area of the body, like one
Yeah.
joint. Oh, I'm the knee
Yeah,
guy. Oh,
you're
no, you have an
right.
issue with your hip. You got to go to the hip guy. And it
Which
like
is crazy.
it boggles my mind.
It is wild.
Especially, yeah. Anyways, all that to say, I think sometimes people, so probably similar to you, when I see someone for the first time, I'm asking about full medical history. I'm asking about
Same.
if they've had surgeries, if they've had injuries. And so sometimes someone will come in, just as an example, they'll come in with like pelvic pain or something. And then I ask about surgical histories and they say, oh, well, I had like a foot surgery. But why do you care about that?
Well,
Or like they'll say, oh, I had this I had like a neck something I had, or a shoulder surgery, but that shouldn't matter. But then you
yeah,
think that even just, I know you have a medical book in the background there about anatomy, but
I
just
do.
thinking about how we're wholly connected with connective tissue, and everything affects everything else.
Yeah, it sure does. And I'm sorry, I was a little distracted. My dog ripped the cord out of my lighting here, so it'll be fine. We'll just leave it be. But
I still see you fine.
you're so right though. They I I have so many clients that come in that will say, "Hey, my shirt or my shoulder has been hurting for 30 plus years," and they're like, I need a shoulder replacement. I'm like, you're probably not wrong at this point. You're probably correct, right? But I always ask them, I'm like, okay, well, when did it start? And they'll be like, oh, well, I was four-wheeling in the backyard with my kids and I fell off. I'm like, okay, did we go see anybody about this? And they'll be like, yeah, I did. And I'd say, well, what did they do? They're like, oh, well, they just said to ice it. They gave me some ibuprofen, a steroid shot, maybe, and I was good. But now at this period of time, 30 years later, I can't even move my shoulder. And it kind of breaks my heart a little bit because you were talking about the medical model. And although I do believe that the medical model has its place, I really think that it does not give credibility towards the actual lived human experience, rather than we're seeing it as different parts rather than a whole. And whenever I have those patients that come in, and I love the fact that you brought up, oh, well, my hip's hurting, but I had an ankle surgery a year ago. And then once you start explaining it to them, do you see that your patients actually start, like, they start getting it? The light bulb moment comes off, and what a good feeling that is, because you're like, haha, you're learning your body, right?
I mean, the light bulb moment is always my favorite, because
Same.
I think anytime, to me, it all comes back down to understanding your body, and the fact that your body is wise, and your body is telling you things all the time. And we just haven't, we've been trained almost to not listen to it, or, we've learned,
Silence
we've been
it.
conditioned to, exactly, to not pay any attention. Or
Yeah.
we've had someone at some point tell us, oh, it's normal to feel pain, it's normal to have
Mm-hmm.
X, Y, and Z happen.
Yeah.
But sometimes people just need someone to explain that these things are connected, because we take for granted the fact that most of the people in front of us, they have no awareness of the body or
Yeah.
anatomy or how things are connected. They're thinking, well, how is my ankle connected to my hip? They're two separate areas of the body.
Exactly. And it's such a cool feeling too. And I have to ask you, for me, whenever I get to that end result for my patient, I kind of do like a little jig. Do you have like a celebration that you do? Do you do anything, or am I just a weirdo?
I mean, I like to do the celebrations with the like with the person in front of me. I like to verbalize like, "Hey, wow, you
Yeah,
couldn't do that before. How amazing." I like to make a big deal of it and make a fool of myself because usually even like the surliest teen will crack a smile when I'm like, "Look at you, you did it. Wow, you're doing amazing." Like
exactly. We all want to be recognized, right? It's not hard. And I really feel that that's what separates good practitioners from the best practitioners, genuinely, is and I'm sure you've probably experienced this too, Laura, and I'm really curious to find out if you have. But I've had patients that have come in and they basically have told me, listen, the medical field has just failed me. It has just failed me. And they come to me and they start asking me all these questions that are so out of my scope of practice that I tell them like, hey, listen, I can give you my opinion on this, but none of this is fact. Like you really need to go speak to this person, this person, this person about this. And it's so strange to me that they'll still continue to ask the questions, which tells me that they just don't have the trust in other people. So I'm curious, have you ran into the same situation? And what is something that somebody can do to try to maybe learn to trust medical practitioners again?
for sure. I think, and again, I it is so hard to know what people's background is, and I try to have the benefit of the doubt for
Sure.
whatever the medical provider that they've seen. However,
Absolutely.
a lot of people do experience some form of medical trauma.
Sure.
And I see it a lot in, I mean, I have a couple of subspecialties that, I see a lot of people with chronic pain. I see a lot of people with pelvic health concerns, spinal issues. These people, they go into these specialists, and the specialists sometimes, even if they may be well intended, I think sometimes they're not being very sensitive to how
Hmm.
I don't even know how I want to finish the sentence, but it's like I think sometimes these patients are getting
I get it.
traumatized because of the way they're being treated, and
Sure.
unfortunately, I see it a lot. Um,
Yeah. And
so what
it is unfortunate. It
it
is.
really
It's an
is,
unfortunate perspective. It is.
it
And
really is.
I've even experienced it myself, right? And in the back of my head, I will tell you, I've never gone to see that practitioner again.
Oh, absolutely.
um,
I would tell the person that too. Like, well, find someone else.
yeah, and that's what I do. I'm like, don't give up, don't give up. Like
Yeah.
this is why it's so important for practitioners to find each other. But I'm sorry, I want to digress off of that subject and kind of move into something that you just talked about that I kind of want to plug into briefly. So you said that you work with pelvic floor and scoliosis patients, right? I'm really interested to see, is there an intersection with that in any way?
Oh, absolutely. I could go on. I know we don't have time for me to go into all of the things, but throughout my own experiences and dealing with my like just people that I work with, it's very much the same. I mean, if you think about the pelvis is, for anyone who's listening who's not aware, the pelvis is basically that big ring of bones at the bottom of our spine that holds our legs. So the pelvis is the bottom of the spine, and that they both impact each other. And when we have issues somewhere, it can lead to issues somewhere else. So one of the deep dives I've done on my website is talking about the relationship between having scoliosis or a spinal fusion and how that can sometimes lead to issues with the pelvic floor, which is the
Huh.
group of muscles that lives at the base of our pelvis that play very important jobs. And
Very.
sometimes they can, yes. So I think sometimes we can, again, just because we tend to compartmentalize, we can just think that these are unrelated issues. But after I actually trained in pelvic health first before I trained in scoliosis. And then when I trained in scoliosis and I started to see the connection there, I couldn't unsee it.
Really? So what was that light bulb moment for you? We were like, wait a minute, there is a connection. Was this a personal situation or is this just you seeing consistent clients over and over like that?
It was more, I started to see, because I treated pelvic health for several years. And so that's any number of issues, including, pain, leaking, constipation. And I would see people with scoliosis, but it was before I really understood scoliosis and exactly what that meant. But
Ah,
once I started working with people with scoliosis, I started noticing patterns of, okay, so
hmm,
they're reporting these things. And then if I would see them for both, I'd start to notice, okay, they're also presenting in this way. I'm also noticing these things. So I
hmm,
started to say, well, okay. And I thought through the, anatomy, and I thought through just physics. And I said, okay, well, this actually makes sense that this would be impacted in this way. And
hmm.
it just started to be, I'm actually trying to do some research on it. I don't have a lot of time or
Okay.
any funding for it,
I
but
hear that. Believe me, I get
it's something,
it.
yeah, something I'm looking into.
I love that. So this might be a little bit of like a red button topic here, but um, I know certain chiropractors that specialize in scoliosis, and you're a physical therapist that specializes in scoliosis. What is the difference? Because I know there's got to be a listener out there right now saying, wait a minute, I'm at my chiropractor for scoliosis. Am I at the wrong place?
It is a bit of a hot topic.
Sure.
What I will say, what I will say is there the approach that a chiropractor uses and the approach that a physical therapist uses are two very different approaches.
Okay.
I will say there are plenty of chiropractors that do a great job with treating people with scoliosis. The
Huh.
reason I would say physical therapy is really well suited for scoliosis care is because it teaches you active exercises to hold your posture and to hold your
Hmm.
body in a way that I don't know that chiropractors do. Maybe some do.
Sure.
But my job as a physical therapist is to teach someone that's coming to me for scoliosis or spinal fusion, to teach them how to use their muscles to hold themselves in a more comfortable and aligned position that should hopefully help
Hmm.
them to feel stronger, have less pain, and basically work myself out of a job. So that someone is only seeing me, maybe they see me more often at first, but then at some point they're feeling good. They may not need to see me
That's
except
how it is
maybe
for
once,
me.
like every 3 months,
I
which is
totally
just
get that.
different. Yeah, which is just a little
Yeah,
different than the chiropractic model, which is, I think,
sure.
pretty much you see people
It's a
over the long
consistent.
term.
Yeah.
Yeah.
And it's very interesting. It's so funny that you say that I work myself out of a job, because that's exactly how I imagine what I do. Because the thing is if you have to continue coming back to see me, like at the same frequency of which you started, something ain't working.
Yep.
Right? We
Right.
need to look at a different approach. Maybe I really need to send you to your physical therapist, get that MRI with contrast, please, people. And and us to actually be able to figure out what's going on. I love the fact you said that, because I've said it to multiple people, and I think it clicks with them to realize, okay, I'm not going to be here forever. And it also gives kind of a light, very, very light promise that they're going to get to where they actually want to go to. Now,
Bingo.
I want to exactly. I want to talk about your website for a minute. Inside of your website, you talk about appreciating the body that we were given instead of longing for one that we wish that we had. Why is that so hard for people? And especially with what it is that we just talked about, I can see why it is. But in your perspective, from a physical therapist standpoint, why do you think that's so difficult?
I mean, that is a challenging question. I feel like there are many things, some of which we've already sort of talked about within this conversation,
Sure.
but also just some of the norms in society of even thinking about the appearance of someone's body
Hmm.
or how
Okay.
someone's body functions. So there's a lot of sort of ableist, assumptions within the world, or, bodies should look this way and bodies should do these things. And
Hmm.
I think that, especially being socialized as a woman, there were a lot of sort of unwritten expectations as to
Mm.
what I should do with my body and how it should look. And the fact that
Mm-hmm.
my body looks different, my back looks different than someone without scoliosis. I carried shame for a long time. And I
Mm.
think a lot of people, and I don't think it's specific to females. I think males, I think we all carry insecurities about the
Sure.
appearances of our bodies, or how our bodies work, or if we have pain. I think it's complex.
Absolutely. So how do you think that mindset changes our outcomes, right? That mindset of I'm just basically I'm not good enough.
I mean, I think it's pervasive. I think it makes our world
I
small.
agree.
I
I
think
agree.
I think we tend to, and I don't think we intend to do that to ourselves. I think it's more, we make assumptions on, or we see the world in a certain way, and we can't see ourselves in a different light, or we can only see ourselves in this very narrow aperture of
Mm.
what we can't do or what our bodies can't be, and it's really
Mm.
it's very limiting.
Mm. And I'll agree. I see a lot of that come through. And I can't say that I've never had that mindset myself. Honestly, it's a rough mindset to have, and recovery feels so far away that way. And
It really does.
I, what is a tool or something that you have possibly given to your clients, or that you would suggest to maybe try to get them just started just a little bit to try to get out of
I
that?
I have so many. I have so many. One of the things that I try to do, if someone is really having a hard time and they're really feeling stuck, and they're not able to find something different, I say, find one thing. Can you think of a single thing that you, either if it's based on appearance, think of one thing that you love about your body. And it doesn't have to be
Mm.
physical. I love the way my laugh sounds. I love the color of my eyes. I have great hair, or something to just maybe shift the needle a little bit more towards positivity. Or if it's about something they can't do, then I say, well, let's think of one thing that, even right now, with whatever your pain is, with whatever your limitation is, what is one thing that you can do that you really love?
Mm.
And start there.
I love that. I do a lot of the mindset shift with my people too. Let's talk about the body for a moment. Let's say somebody just went through this very invasive surgery where we're talking about a fusion. Let's say that they've gone through a fusion. What is the biggest piece of advice that you could give this individual right now?
Well, first I'd say congratulations and welcome to the Bionic Spine Club, card carrying member since '97.
Love it.
And another thing that I would say is, outside of finding a physical therapist that can help you rehab, which there are plenty of us, I would say, even if you're in the dark part of your recovery right now, where things are feeling really challenging, and you're having a hard time, can you just stop and appreciate how your body went through this big thing, and now you're on the other
Mm.
side of it, and how
Mm.
awesome and resilient you can be, even with everything you've gone through. And that's really a feat. You are stronger now than you were before you had this big surgery. And the other big
Oh,
piece of advice that I would
love that.
offer is, get moving. We got to get moving again. We got to find something
Mm-hmm.
to get you back on your feet, something that lights you up and is going to make you happy.
I love that so much. I tell everybody, number one, emotion needs motion, right? That's just how we work. And then number two, chronic pain, we don't deal with it the same way that we deal with like an injury, right? Chronic pain, we have to move it. We've got to exercise it. We need the topical analgesics, right? We need all of those things, therapy specifically, to make sure that we're able to push past that. So I love that message that you just gave. So on the final end of this story, something that I found really interesting was that you work with people all over the world virtually. I would love to learn a little bit more about that. What do you do? What has it taught you about maybe the adaptability of the human body?
It's an excellent question. I have seen some really awesome things for people literally all over the world, people sitting right in front of me here in the Atlanta area, all the way to I've seen people in the UK, I've seen people in Asia, I've seen people on the other side of the country. And I think just having a little bit more knowledge of how your body works and why sometimes you're feeling the things that you do can be really, really helpful and comforting to know that, feeling validated in what you're experiencing. And also that sometimes it just takes a little shift or making some little changes throughout your day to really make a big impact in how your body feels, whether that's pain, whether
I
that's
love that.
strength. And it doesn't have to be big. It doesn't have to be like you don't have to make giant changes or invest in some really expensive program or, it's just about being intentional and setting your mind to it and, committing to something new and different.
Love that so much. So you talk about this idea of radical acceptance too, right? And I think we've touched on this, but I really want to dive in on that and understand, how does somebody radically accept themselves? How does somebody, like, what are those steps? What does somebody have to do to be able to really make that happen?
Well, I think it's important to appreciate and understand where you are. And also, I think it can be challenging to find to meet yourself where you are and to say, okay, this is where I am today, to not be in denial and to take a really, good, clear look at what your current situation is, the things that you like about it, the things that you don't like about it. And so I like to use the example of like body image is one that most people can kind of understand, even if you don't have pain. So usually there's something about the appearance of our bodies that we would like to change, whatever it is. So for a lot of people, that can take up a lot of their brain space. So one of the things that I say is, okay, this is the thing. We can't change this thing. This is the thing that you have. For me, it's the appearance of my back. My back is always going to look like it is. I can't change that. But what I can do is find a way to say, all right, this is what my back looks like. And even if it's a day when I can't be positive about it, I can at least be neutral about it. Say, okay, this is my body. She is good as she is. I don't have to change her for her to be good and for her to do amazing things, like be an athlete and be a physical therapist and be a mom. And, just accepting the things that we can't change.
I love that. Kind of like almost like the serenity prayer, right? Like in that way. I love this so much. So I really just want to kind of I wanted to wrap the show with that because I think it's just such a really important topic. So if somebody's listening today and if they're feeling frustrated with their body, right? Whether that's the image, whether it's pain, it's the mobility, it's flexibility, whatever it may be. What's one thing you want them to remember when they walk away from this episode?
I would say, I think it's important to, wherever you are today, to sit down, maybe it's with a piece of paper, or maybe it's with a phone or a computer, and to just sit and make a list of maybe the things that you do appreciate about your situation, or the things you do appreciate about your body, or make a list of the things that you enjoy, and try to find a way to first, before we go anywhere else, try to change the mindset on, yes, I'm dealing with these things, and it may be a terrible thing you're dealing with, and it may be something that you wouldn't wish on your worst enemy. And still, something in your life is probably pretty awesome and something that you can at least focus on. And once we start making that mindset shift, we can be more in a space to make some changes that can hopefully change the situation.
I love that so much. It really speaks a lot about what this podcast is. It's literally taking pain and moving it to performance. And that is such a great piece of advice. of advice. I think, Dr. Laura, I think that's a really good way to end it. I have really enjoyed getting to speak to you today and to get to kind of pick your brain a little bit, maybe touch on a couple of topics that were a little warmer than others. I really appreciate your time today. Thank you so much for joining the show.
Thank you for having me. It's been fun.
Before we take off, one quick housekeeping thing. This podcast is for education and conversation only. I'm in no way a licensed therapist, doctor, wizard, and this show is not a substitute for care from a qualified professional. If something today made you think of someone you know, go ahead and do them a favor and send this episode their way. Pain is rarely a solo experience, and a good conversation is better shared. And if you're enjoying the show, make it official. Follow, subscribe, leave a review. It helps more than you realize and keeps this conversation going. Remember, the hardest part of pain to performance is learning how to listen. Now, I'll be here, same place, next play, and I can't wait to welcome you in.